And new tonight, new legislation is in committee that would set statewide limits on the number of patients nurses can be assigned. But the Michigan Health and Hospital Association says if the limits are mandated, it could restrict access to health care. TV6's senior reporter Jerry Tudor shares what the legislation is and what the impacts could be.
Two bills in the Michigan legislature address staffing in hospitals. Proponents call the overall package of bills the Michigan Safe Patient Care Act. The bill's language includes limiting the number of patients nurses can be assigned and prohibiting mandatory nurse overtime except under certain circumstances. Members of the Michigan Nurses Association back the bill and say they're understaffed and take on too many patients.
Understaffing, we see long patient wait times in the emergency department where people are waiting in the waiting room and such without being seen by a nurse. Our patient ratios are up to seven patients per nurse instead of the proposed 1 to 4 patients by the bill.
The Michigan Health and Hospital Association opposes the legislation. The MHA says the bills will not solve staffing shortages or improve patient outcomes. Instead, it will cause harm to patients. The association says it will cost Michigan hospitals $1.1 billion to comply with the potential law change, leading to hospital closures and eventually higher health care costs. In a statement, the UP Health System spokesperson says, "This bill removes nurse staffing decisions from clinical leaders at the local level and instead creates a one-size-fits-all cookie-cutter mandate for all hospitals in Michigan, regardless of size or location. More patients will be at risk of severe outcomes because they will face longer delays in receiving care, particularly if they can't be transferred from hospitals that are not equipped to deal with their conditions." Raudio says that 90% of Michigan nurses want the legislation to pass.
We think this would greatly benefit the state here, bringing back some of the 50,000 nurses right now in the state of Michigan that are licensed and not working. Poor patient ratios right now are the number one reason that nurses are leaving the bedside. A poll by Michigan Nurses Association showed that 93% of nurses in the state would like this bill to pass.
The bills are currently in committee. We will keep you updated on their progress. Jerry Tudor, TV6 News, Marquette.
Thank you, Jerry.